Greetings, everyone. My name is Anishima Gloria, and I'm a student at the University of Global Health Equity and also the president of the Inner Surgery Interest Group, which took part in organizing this blood donation. We are very happy to welcome you to this very important discussion and delighted to welcome the group of panelists who are going to help us in this discussion. So first of all, let me first tell you about the Inner Surgery Interest Group while introducing the Inner Blood Donation. So the Inner Surgery Interest Group is a group of students at the University of Global Health Equity who are interested in pursuing surgery as their career in the future. Some of the objectives of the group include stimulating and creating interest in global surgery, collaborating with other surgery interest groups, either internationally or nationally, creating opportunities for students to get exposure to global surgery, and facilitate them to get opportunities to join the global surgery and see what their role can be. Some of the activities that we do are seminars where we get to meet people who have been through this journey and tell us what it was like or what it is like and give us some advice. We also do some community outreach, which involves this inherent blood donation, where we do some activities to give back to the community. We also organize anatomical competition to familiarize students with some concept they're going to deal with in the future. We also carry out some research and global conventions. So the United Blood Donation was established with the objectives to support the national blood banks and transfusion services in Rwanda be able to collect blood. But it was also established to help increase awareness and knowledge about blood donation at the UGH and the Butaro community at large. I would also like to encourage the UGH and Butaro community to donate blood voluntarily, not necessarily waiting for this kind of events to be organized, but also have the courage to give blood voluntarily anywhere you might be. So the expected results are somehow like the objectives, because we expect to save lives and help RBC save more lives through the blood donated by the UGH community. We also expect to make this blood donation a life-saving culture in the UGH community and Utara community. As also I said, we'd like to increase awareness and knowledge about the blood donation, and we would also like to help RBC collect blood from UGH community and Utara community. So our first blood donation happened on June 30th, 2021, in collaboration with RPC and the UGH Health Department with the UGH Comms Department for Publicity. So we had 66 donors and collected approximately 30 liters of blood, and we would also like to thank all the donors who participated. In the future, we would like to carry out this blood donation every 4 months in the UGH community, and we would also like to expand this initiative to the community of Butaro through education, telling them about blood donation, when and where and how can they do it in their daily lives. So thank you. That was it about the introduction of the inherent blood donation. I think we can move on to the next program.
Hello, everybody. Do you hear me? Okay. So thank you, Gloria, for this warm welcome to our speakers, and also to presenting the context of why we are together. So it's my turn now to welcome all the speakers that are with us today, but also to recognize that, Gloria, you spoken on behalf of our students in Bachelor of Medicine, Bachelor of Surgery, who are also doing a Master in Science of the Global Health Service Delivery because they pursue the double degree. And also you speak on behalf of Intare Interest Group that have done so great for our communities. So good afternoon, good evening, good morning to all of you, wherever place you are in the world. And again, I'm delighted to welcome you all for this month's organized webinar where experts global health leaders and champions are giving space to discuss public health current trends and challenges surrounding one UN World Day. We are grateful for our wonderful panelists for joining us today and to share their knowledge and expertise. Before starting, I have some logistical information to share. To ensure access for people who are hard of hearing, please access the closed captioning function on the bottom of your Zoom screen. You can access this by clicking on the closed captioning, CC, but that is on the bottom, and you will benefit from real-time text translation. For the person with visual impairment, our participants have been prompted to be more descriptive for any image they have on their slides. Lastly, feel free all along the webinar to submit your question in the chat box, for they will be answered during the Q&A at the end of the presentation. And know that all the questions that will not be answered during the webinar, they will be answered within a week and sent to you. You can access them through Twitter, Instagram, or Facebook. So last month, the world has celebrated the World Blood Donor Day, and the UN commemorated that day to raise awareness on the need for safe blood and blood products. The UN theme of 2021 was Give Blood and Keep the World Beating. And this urged the international community to emphasize the critical role of blood donors and highlight the global demand for more blood donation to save lives, and to attribute better health for, and to attribute and produce better health for the societies. According to the World Health Organization, it's really an important matter, because about 118 million blood donations are collected worldwide, 40% of which are collected in high-income countries, accounting only for 16% of the global population. This means that there is a significant difference in the amount of blood collected in low and mid-income countries compared to high-income countries. In low and mid-income countries, it is 5 donations for 1,000 people, while in high-income countries, it's 31.5 donations for 1,000 people. And for example, 79 countries accumulate 90% of the blood supply, mainly from voluntary unpaid blood donor, and over 50% of blood transfusion is accounted for children under 5 in low-income countries, where it is 75% of blood transfusion for the over 60 years old in high-income countries. So you can see that the need in blood are distributed differently when you are in a low-income country compared to the high-income country, but also there is the need and the lack of blood is higher. The shortage is higher in low-income countries. Globally, researchers have also calculated the need for blood supply to be nearly 305 million blood product units, and currently we have only 217 million units. Therefore, to bridge the gap of approximately 30 million units and reach donation target to help provide a more equitable future for all in the context of universal health care, a collective effort from different parties have to be done. This concerns government, civil societies organizations, communities, and scientists. However, especially during COVID-19, there has been a significant drop in the number of donations, which is limiting the ability of nations' blood supply to be adequately replenished. And this creates fear of blood supply to be depleted. The WHO estimates that between 30 to 30%, that is the reduction of blood supply worldwide. This estimates global blood shortage that is unprecedented and due to the pandemic has left many hospitals with problems in managing emergencies and obliged them to delay surgery because there is no backup in case of bleeding during the procedures. In the US and India, this is evident from the current decrease of capacity to provide healthcare to trauma, transplant, and surgery cases due to severe blood shortage. With this knowledge, I cannot go without saying that coronavirus does not pose any known risk to blood donors during the donation process or from attending blood drawing if protocol and guidance issued by all the CDCs across the world and WHO are strictly followed. There is no known risk as well of transfusion-transmitted coronavirus. So we need people to donate today to ensure that blood is available for those who need it tomorrow to remain alive. In my country, Rwanda, the National Center of Blood Transfusion Division at the Rwandan Biomedical Center serves as a great example of an institution that organizes safe blood donation in a well-organized system and is integral to the national health policy documented by the Ministry of Health. Consequently, in 2019, Rwanda became the second African country to host World Blood Donor Day. Along this line of leadership, my university, the University of Global Health Equity, followed this trend by launching its first blood donation event on campus. As Gloria told you, this was the 30th of June last month. Students, faculty, staff were actively encouraged to partake in this beneficial act for all that increase awareness for donating blood, but also has engaged the community of the sector where we live in Butaro, where the UJG campus is located, but also as well as in Kigali, where the blood donation drive also occurred. UJG students plan to have this day celebrated every year and to expand its audience to community members as contribution to the wellness and better health of the communities where they live. To go along with this initiative, the specialist in blood banking program course in partnership with the Rush University was also created in alignment with Rush University's and UJG goal of excelling in solving major health-related problems by applying innovative solutions which are based on evidence. We will hear about this, all this with our panelists shortly. Overall, during this critical time, it is not only our duty to donate blood and raise awareness for the causes, but we also should be, it should be integrated in our traditional value. Let us discuss with our wonderful panelists what the situation is and what are the proposed solutions in their region concerning blood safety and supply. Let's discuss also the specialist in blood banking program course partnership between UJG and Rush universities, as well as our students' community engagement to mitigate harmful effect of the lack of blood supply. Before to dive into the discussion, let me ask each of you to, all along the webinar, post your question in the chat. They will be answered during the Q&A that will follow. So join me in giving warm welcome to our first panelist, Laurie Gaillard, who will be sharing with us today the impact of COVID-19 on blood supply in the United States. Laurie, the floor is yours.
Hello, my name is Laurie Gillard, and I'm the director of the Specialist in Blood Banking Program at Rush University in Chicago, Illinois. So today I'd like to discuss the impact of the COVID-19 pandemic on the blood supply in the U.S. and to highlight the importance of blood donation for our patients everywhere. So these are my objectives. So I'd like to begin by providing a little perspective. Between 2017 and 2019, there was a national survey that showed that the number of red cells collected in the U.S. decreased by a little more than 5%. However, the number of transfusions increased by 2.5%. Apheresis platelet collections decreased by 2%, but the number of platelet transfusions increased by almost 16%. I mention this because there was already a decline in blood collection leading up to the pandemic. So the first COVID-19 case was reported in the US in the state of Washington, which was approximately 3 months after the outbreak in Wuhan, China. 3 weeks later, the US federal government declared the pandemic a national emergency. In Washington state, the first week of March started with 4 confirmed cases and ended with about 150. And by the end of the second week, there were more than 700 cases of confirmed COVID-19. So during the first week, blood donations dropped significantly. So blood was provided from blood centers of non-affected areas around the country. So we have a national network that moves blood around. But this helped to keep their inventory stable and, continue routine hospital operations. Now, during this time, the hospital-based transfusion service began prospectively triaging blood orders to monitor and prioritize blood usage. So in the second week, the hospital postponed elective procedures to ensure that staff and PPE were available for the care of the critical patients. So this happened first in Washington state, but it was not long before the rest of us were doing the same thing across the US. And I'm sure across the world. So as the pandemic grew, the FDA set up and facilitated access to COVID-19 convalescent plasma for use in patients with serious or life-threatening COVID infections. So at the time, clinical trials were underway, but the FDA allowed the clinicians to use investigational plasma under this special application, since there was really no known cure and no vaccine at that time. But so now the blood collection centers began collecting the CCP. So as you know, CCP, it's plasma. So it has the same, in the US anyway, has the same infectious disease testing as regular plasma, but now they needed to test for the COVID antibody. And then concurrently, hospitals had to set up their own processes for bringing in the product and distributing it to the patients. So that was a huge endeavor. So in the US, since 1983, men who having sex with men, we call it MSM, have been indefinitely deferred from donating blood. So it's something that has been talked about probably for the last 20 years, but it took COVID for the FDA to address this donor eligibility requirement and actually modify it. So the FDA guidance allowed blood establishments that collect blood and blood components using the revised donor deferral recommendations to actually collect from individuals with increased risk for transmitting HIV infection. So this guidance was actually based on the agency's evaluation of all the available data, including data regarding the detection characteristics of using, we call it NAT testing, but it's nucleic acid testing. So the FDA does not expect any adverse effect on the safety of the blood supply. So what they were hoping for really is early implementation of the recommendations of the guidance to help address this significant blood shortage. Really, that is still ongoing. And because of this, we have an ongoing public health emergency, which is COVID.
So thank you, Laurie, for an insightful presentation explaining the problem the US have faced in the shortage of blood and the consequences during this pandemic and the solution that you propose. Now, I would like to give a welcome to our second panelist, Dr. Marcela Contreras, who will be sharing with us sufficiency and safety of the blood. So, dear Marcela, the floor is yours.
Good afternoon. My name is Marcela Contreras, and I'm grateful to Professor Agnes and to the University of Global Health Equity for inviting me to participate in this very important webinar. Although I am Chilean and my medical education was in South America, in Chile, I spent most of my professional career in the United Kingdom, in London, in the National Blood Service, first with Professor Pat Mollison, and then in the UK National Blood Service. I would like to remind you that there are many countries that do not have sufficient blood and do not have blood stocks available. And this happens in many African countries. I worked with Malawi and with Botswana and many Latin American countries and some Asian countries, and I realized that a sufficient blood supply is not the case in many of the countries. For example, in Malawi in 2007, visiting a hospital, there was only 1 unit of blood for the whole of this large hospital where many patients needed blood, and there were children having to wait for hours or sometimes days for a unit of blood to be available for them. Many of them died waiting for blood. So, what are the general approaches for a safe blood supply? Well, we need effective donor recruitment of voluntary, unpaid, regular blood donors. They need to be repeat voluntary donors. Donation screening using sensitive methods, integrity of the systems to ensure that the labeling is correct and error-free, ideally with CODA bar labels, blood grouping for ABO underage, microbiological screening for mandatory markers using well-controlled systems, standard operating procedures, well-trained personnel, and quality control systems. Just to remind you that it is only rich countries that have 100% voluntary blood donations. The rest of the countries do not have nationally coordinated blood systems and therefore do not have 100% of voluntary blood donations, especially many of them do not have regular voluntary donors. So what do we need for a sufficient and safe blood supply? Well, countries need a blood plan with planning a national network of blood services, promoting voluntary unpaid regular blood donations with the abolition of replacement donors or family donations as well, quality assurance of all processes, timely access to sufficient blood and blood components for all patients in need, and in addition, appropriate use by clinicians. And it is only possible to achieve this with a nationally coordinated. What are the benefits of this nationally coordinated or centralized blood transfusion service? Well, that the message to donors is unified, it's public, it's personal, there's national publicity, and donors have easy access to donation clinics wherever they are. There's national quality incident reporting, and so it's easier to learn from mistakes. Standards are national and unified. Stocks are national. Blood can move from a place where there's abundance to a place where it's needed. And nowadays, with transport systems, it is easy to transport blood. And blood, remember that blood can last for several weeks if it's appropriately stored in cold chains. And there are economies of scales, makes clinical governance, compliance, and accreditation easier, and it's easy access to specialized blood components and to rare blood groups. Other advantages are that there's a national centralized IT system with unique donor identification number that allows donors to move around the country and give wherever they are, because there will be the national donor IT system will recognize the donor's history wherever they are. There's shared expertise of specialists, concentration of medical and scientific personnel, and research and development is national, and you can have a national hemovigilance system to investigate adverse reactions to donation and transfusion. So I hope I have convinced you that in order to have safe blood, you need a regular supply of voluntary repeat blood donors based on a nationally coordinated blood service. For my services in the UK, for the reorganization of the National Blood Service, the Queen awarded me with a of Dame Commander of the British Empire, for which I'm very proud. Thank you very much.
Thank you, Marcela, for this presentation. I think we will have a lot of questions for you also during the Q&A. But before that, we are going to listen to our last panelist, Dr. Daniel Seifou, who will do a presentation about the specialist in blood banking program course that is launched at UJG to respond to the need in sub-Saharan Africa that Marcela has evoked. And so that means it's a response to a need. And Dr. Daniel, the floor is yours.
Good morning and good afternoon and good evening to our audience attending this webinar. My name is Daniel Seifou. I'm an associate professor and head department of biochemistry at University of Global Health Equity, and I'm also program director for specialists in blood banking. I'm very grateful to be a part of this webinar presentation. My talk will focus on the needs, challenges, and the way forward in blood transfusion and supply in sub-Saharan African country. I will try to be very brief for the interest of time. The last months, on June 14th, we celebrated the World Blood Donation Day. The reason we celebrated this occasion is to mark the very importance of giving blood to save life. If you look at the recent WHO report on global blood donation, nearly 120 million units of blood are collected. And of these, 42% of the blood collection is in high-income countries. The contribution of low-income countries is less than 2%, as you can see. And because of this, more than 7 million Africans suffer with a shortage of blood every year. There is also marked differences in pattern of blood use. Up to 65% of the blood transfusions are given to mothers and children under 5 in low-income countries, whereas in high-income countries, the donated blood is given to elderly patients, accounting for up to 76% of all transfusion. Based on this evidence, the high-income countries seem to handle the blood transfusion service effectively and efficiently as compared to the middle and low-income countries. The reason why the low-income countries lag behind could most probably be due to the complex nature of blood collection, the processing, storage, and delivering of the products to the needy patients that involve several stakeholders. As most of the countries in the world accepted WHO strategy for universal blood transfusion services, some of the sub-Saharan African countries have witnessed improvement in terms of reducing transfusion transmissible infection, increase in blood product testing, pathogen reduction, and also enhance quality assurance like establishing homovigilance and provision of tailored education. However, there are still challenges that most sub-Saharan African countries must work on. For example, absence of post-transfusion surveillance with uncharacterized transmission risk, and also incomplete epidemiological understanding. And there is also use of suboptimal testing platform, like limited ability to adopt high-performance alternative testing strategies, and absence of molecular testing, unreliable supply chain and procurement of screening reagents. And there is also a limited quality assurance testing, like mostly monitoring and evaluation uses operational rather than performance indexes. There are also limited access to educational program, lack of coordination of educational activities, approach to prioritization of need is unclear and not assessed objectively and or systematically. There is also a rapid decline in external fund and little monitoring of performance standard and support of policy despite incomplete data and lack of evidence. So it is expected that the global as well as the sub-Saharan African countries' blood demand will continue to grow. The existing challenges need to be carefully addressed, and the sub-Saharan African countries must come up with a solid strategy based on concrete evidence to improve transfusion blood services in order to save African mothers and children under 5 years of age. So all of these suggested solutions are applicable and they can be implemented provided that all stakeholders are committed. To list some of them is just to reduce the blood transfusion need for anemia-related diseases, like by developing vaccine against malaria infection, and also increased use of drugs like hydroxyurea, and also use low-cost antifibrinolytic agent for patients with obstetric hemorrhage, and also discontinue blind transfer of principles and method used elsewhere, and use a more pragmatic approach, considering local conditions like clinical needs and limited resource together with systematic collection of evidence supporting proposed changes. So progress in sub-Saharan African transfusion would probably be slower, but be more effective and sustainable if support is given to fund transfusion research conducted within the region that aimed at finding local solution to local problems, and also develop more sensitive and cost-effective testing along with improvement in infrastructure. And then again, education in transfusion medicine will have to be comprehensive and occur at all levels and include teaching nurses, doctors, how to monitor patient receiving transfusion, development of standard operation practice for both for cross-matching tests and blood unit and patient identification. And then, of course, the education is probably the most cost-effective aspect of helping the low-income country build a safe and effective blood supply. And now, nowadays, many volunteers from around the world that are already volunteering their time to improve transfusion medicine practice through teaching nurses and medical student fellows and clinicians. As you well know, the University of Global Health Equity has an ambitious strategy to lead and implement global health care delivery in equitable manner to all people around the world. As the University of Global Health is a top performer in terms of adapting and implementing the best practice educational training to its community, thanks to Professor Agnes and Professor Abeba and leadership of Rush University for their commitment from the initiation to the realization of this specialists in blood banking program. This year, our university completed all the necessary arrangement with its partner, Rush University, to launch an online certificate program in specialists in blood banking in September 2021. It is the result of collaborative effort between Rush and the University of Global Equity. It is a 2-year pilot program mainly supported by Rush University. And for these 2 years, the program will be handled by Rush University, and however, participation of the local faculty is more likely. After 2 years, University of Global Health will take over the program, still in partners with Rush. The program has already recruited 2 candidates, one from University of Global Health Equity, and the other candidate is from Rwanda Biomedical Center. The program is the goal of this program is to increase national and regional capacity in blood transfusion services through human resource development. The program focuses on training laboratory technologies, clinicians, medical students, fellows, and nurses. And of course, after completing the certificate program, the trainees are expected to work and improve the blood transfusion services and work closely with all stakeholders. The program also uses integrated system approach to improve some of the challenges in blood transfusion service, and also advocates and create awareness at the community level through community engagement approaches. And that's all from my side. And if you have questions, you are most welcome.
Thank you, Daniel, for your insight and how we have how big is the problem in sub-Saharan Africa. It completes very well the presentation given earlier by Marcela. And also the solution that you propose that includes teaching and education, and how the online program that award a certificate that we have launched with Rush University is part of the solution. And you have talked also about the Rwanda Biomedical Center will send one of the first students, and it's important because the Rwanda Biomedical Center has a blood transfusion division, and this blood transfusion division is already a model in Africa, because it's an institution that has started to respond to the problem highlighted by Marcela, that many countries doesn't have a centralized system that guarantee the quality, guarantee the distribution all along the chain of distribution, all along the chain of collection, and also the safety of the blood, doing the tests before, and the packaging, etc. And they are doing that, and we are very proud in Rwanda to have that. And the training that we'll be giving in partnership with Rush will increase their capacity. And we hope that with this practical example of a national program, plus the training, we will manage to bring changes across Africa. And that in Rwanda also, because it's organized, and because, as what Gloria showed you, there is a support of leadership, or there is, we don't necessarily have the blood we need. We have a shortage, but the blood we have is voluntarily given by everybody. You have days like that in the police, in the army, in the market. And people knows that they are not going to be paid. That's the first thing. But also the population know that when they will need blood, so far it's given to them, and also for free. So there is awareness, and there is also a willingness to do that under the leadership of the Ministry of Health, who need to do, who do guidelines. And also something that is great, because we don't have a big country, but a very hilly country. You may have 4 hours for some place where you have from Kigali to go up country. And because of that, we had many centers to store the blood. Too much blood in some place that we had to throw after 7 weeks. So now we have decreased the number of storage place, and we deliver the blood with drones. Maximum 35 minutes from every place in need in the country. So it's also another innovation to have less, to make the blood more accessible, to make the blood be given on time when you need it, because if it's come too late, like I was discussing with Laurie 2 weeks ago, we were together, when you don't give it when I need it, I die. When you don't give me the right blood, I will die. I may die immediately. And if we give me a blood that is not safe, I will die maybe a couple of years later, but because of that blood you give me. So all this is very important. It saves life, but only if well given. And it will be well given only if, like Marcela, Laurie, and Daniel have expressed, if you have a secure collection system and a secure distribution system, and people that are educated to give it according science. So thank you to our speakers, to our panelists for the interesting presentation. And I remind all of you that you can put question in the chat, that all questions will be answered after the webinar, if we don't have time to do that during the webinar. And there will be answer on Twitter, Instagram, and Facebook using the hashtag #AskProfessorAgnes. And our wonderful panelists have committed to answer each and every question. So go ahead and don't hesitate. We are now going to drive in the Q&A session. And my first question is for you, Laurie. Since the Food and Drug Administration in the US released the guidance for new donors eligibility requirements, how this institution assessing whether or not the new requirements are improving blood collections?
So right now there's a study going called the Advanced Study. It's an acronym for whatever, but it's basically recruited a bunch of, like I'm going to say about 1,500 people from the, the LGBT community to see, to get them to donate and to see if that helps to improve or the numbers. But the funny thing is, so they changed this guidance, and they even changed some others, because with the NAT testing, this nucleic acid testing, it's so sensitive that they can detect, the different viral particles at very, very, very small amounts. So now they've even changed the deferral for people who've been exposed to, say, a needle stick or some blood. But anyway, we are in such a critical shortage that I don't think it's really made much of a difference yet. I think long term it will make a difference, but they're still creating or still, doing this study, and it hasn't been published. But it's a very interesting thing, because the Office of Human Rights, because a lot of homosexual men wanted to donate blood and they could not donate. And this has literally been in the works for probably 20 years. And COVID, so one of the positive things about COVID is it really forced change. I mean, there's so much negative, but there have been things that needed to be changed. And now even being able to do this on Zoom, we've gone through a paradigm shift. So yeah, we don't have the numbers yet, but we're still in a very severe shortage. And I have to admit, today I'm going to go donate blood. I've been meaning to. Listening to this, it made me. Anyway.
Thank you, Laurie. Thank you, Laurie, for your answer, and also for the major problem you raise about the human rights. First of all, it's also the right to participation is a human right, and the right to participation as a solution for your nation problem in blood shortage should not be denied to you. It's a human right to participation. Thank you for raising that. And also it's linked with all the disease we can have when receiving blood, but it's a stigmatization of some people for other disease to not be allowed to receive it. So my next question goes to you, Marcela. What circumstances in your community or in general made you aware of this need to advance blood banking and transfusion knowledge?
I've always, since I qualified, I've been interested in blood transfusion and blood donation and blood services. So I was aware, and I was interested also in transfusion medicine, in the appropriate use of blood. So when I started as an immunohematologist, just doing, I'm an immunologist by nature, but then I became interested in transfusion-transmitted infections with John Barbara, and I realized that in parts of the country, there was a shortage of blood, and in my area, I was the director of the North London Blood Transfusion Centre. We had enough blood. We always had sufficient blood. And I realized that doctors were not using blood appropriately, or hospitals were storing blood without needing it, as you say, for your country as well. So I realized that there was a need for a really national blood service. We've always had blood centers in the UK, but here we needed a national blood service where blood and our knowledge and our expertise was shared throughout the country. And fortunately, the Minister of Health asked me more than 20 years ago to do a study of the blood services, and I realized the inequalities in the north compared to the south, and I proposed a closure of some of the blood centers and a nationally coordinated blood service with only one management for the whole of the country, with one hemovigilance system. We have short, I recommend to you to read the short serious hazards of blood transfusion. We publish every year our reports on the serious hazards of transfusion, and this is a national system of hemovigilance. We have a national, also a patient blood management. That means the chief medical officer in the country, there was the political will, and this is what's lacking in many countries, political will to have a national blood service. And the chief medical officer started a circular called the Better Blood Transfusion, mandating hospitals to have hospital transfusion committees, mandating hospitals to have proper hemovigilance, and mandating nurses and doctors to learn about the appropriate use of blood. In this way, we didn't have the problem that the United States has had, and that Laurie has explained very well. We were collecting more than, we were collecting lots of blood, and we decreased our usage of blood by more than 1 million units without having any shortage. So it's been quite a good lesson for us that educating clinicians, as your last speaker as Daniel has said, educating clinicians and nurses in the appropriate use of blood will decrease blood usage in a country. So we've had good collections and decrease of usage by more than 1 million units. And that's been a real success. So those have been my major issues. Thank you very much.
Just thank you. You have given us a very good information on what to do when we want to start to a rational way to work and create a system for blood connection and blood distribution that is safe. Dr. Daniel, can you please explain and expand on your presentation what you mean by low and mid-income country lagging behind in blood transfusion services, and why do you think that there is less blood collection in low and mid-income country as compared to high and mid-income country? You and Marcela have expressed that, but could you expand and go in detail?
Yeah, thank you very much, Professor. It's a very good question. The reason I said that the low-income countries or class, of course, the middle-income countries lag behind in terms of blood collections, it has several factors actually that can account for the inadequate supply of blood in many, African even healthcare systems. So first one is like absence of sufficient voluntary non-remunerated blood donors. We are lagging behind in educating our people to donate blood voluntarily. In addition to that, there are also several other additional reasons that make many people more reluctant to donate blood for reasons like fear of getting transmissible infection, like fear of losing something very valuable from their body, so that they may not feel safe later on. And in addition to that, we also see the local perception and cultural belief about the way that the bloods are collected and also transfused. So these perception and beliefs are common within the communities that partly due to lack of education. And also like this perception and belief have also implication later on for those to organize, effective design and implementation of the health promotion programs, and also campaign to enhance blood donation. So understanding the perception is relevant, and as it can inform decision making in clinical practice and policies that promote blood donation. So in addition to that, also collection of the blood is usually done through campaign. We're not doing it regularly. So there is a limitation in that sense. And of course, resources are also one of those factors that could add or make the blood donation lower than the developed country, like infrastructure, facilities, reagent, refrigerators, and all those things. So there are several factors that contribute to that. And in addition to that, like I said in my presentation, we usually, blindly, accept principles and methods from West, so that we try to implement it without, understanding it well, or so that also creates a complication in terms of collection, plus of course managing the blood transfusion services altogether. But putting up all those things, if we try to see our own problems holistically, or maybe use system approach, then we might increase the blood donation or collection, so that we can improve the blood transfusion services altogether. That's what I'm just thinking.
Thank you for expanding on that, Dr. Daniel. The next question will go to you, Gloria. As a medical student and who contribute to organize the blood donation in our university, the University of Global Health Equity, what inspires you and your fellow colleagues in organizing such an event, and also to donate yourself? This could inspire other young people and other adults to be voluntary blood donors across the world, and also inspiring us on how we can help to make it happen.
Thank you very much, Prof. Agnes. I think growing up, I really, really wanted to donate blood sometimes, but I was not able to donate because I was not yet eligible. So being at UGH as a medical institution and having a chance to learn more about blood donation or blood, and how some patients can die after losing blood, or due to hemorrhage and other diseases. So I really felt like there's something that we as students, though we're still learning, there's something we can still do to contribute to the blood that is given to patients around either our country, or even encourage others to donate. So starting with UGH, I think there are lots of young people who are eligible to donate. We saw it as a very good opportunity to start sensitizing people at the University of Global Health Equity to start donating. And also the Inherent Surgery Interest Group is very eager to contribute to the Rwandan health system. So we really wanted a way we can contribute, and we saw that blood donation as one of the ways. And having really good mentors at the University of Global Health Equity who helped us know where to get the information was really a helpful journey. So I think some of the young people out here don't really sometimes know the right information of where and when to donate blood. But I think being at UGH showed me that it is possible, and showed me the ways I can do it. And I felt like extending it to others. And that is why we are very excited and want to do it in the University of Global Health Equity, but also go outside the University of Global Health Equity to the community, and be able to tell other people how is it done, when is it done, so that the country can increase more voluntary donors. Thank you very much.
Thank you, Gloria. Great insight. So it's up to us, the grown-up, the old people, to find the young people where they are, use their energy and their goodwill to save the world. You are there, we are not enough with you. I take it. Laurie, I want to come back to you. Could you tell us how the US responded to the blood shortage during COVID? Were there any innovation that occurred? So that means we always have an ordinary shortage. COVID has improved that, improved the need on top of the hospital to be overcrowded by cases. Were there innovation in the US that could help all of our countries to do better on day-to-day basis?
Well, one of the things that was really interesting, blood donation, a lot of blood donation occurs at mobile collection sites. So they would go out to workplaces. A lot, probably 20% of the collections come from high school students. Well, when COVID hit and everything went remote, boom, it all stopped. So I think they really learned that they ended up having these different, well, once things sort of settled, oh, the other thing too is when COVID started, all of a sudden, like I mentioned about Washington, because it was kind of looking at it and thinking, oh, look what's happening in Washington State. That's thousands of miles from us. But it was like this huge tidal wave that hit everybody. And so they ended up, the blood shortage wasn't as impactful because surgeries were canceled, all those elective surgeries, all the outpatient stuff, everything's shut down. So we ended up not having, in the beginning, not having so much of a shortage of red cells, because red cells in this country with preservatives, like they're good for 42 days. But I mean, now we're having problems. But collecting platelets has been a big issue because our outdate's 5 days. But anyway, but what they're doing now is they're doing what they call pop-up blood drives. So they couldn't, when the high schools weren't going on, they ended up, a lot of places, public facilities that had extra space ended up volunteering to host blood drives. So that was one thing they did. The other thing that was interesting, because this was like everything had happened, everything was just so new. When they started collecting, and I don't think there's so much collection for the convalescent plasma, but in the beginning, that was the big thing. That actually created a lot of awareness, and people, that brought a lot of media attention to donating blood. So there were a lot of people who would go out that had recovered from COVID who wanted to donate their blood, really their plasma that was pulled off of the blood for the COVID convalescent plasma. So that was kind of interesting. But I think the big thing now though is they realize they can't expect to always collect blood from going to these sites like the high schools or the workplaces that they did in the past. So I think now they're trying to be a little more, their innovation is just looking at other places that they could go. And so it's not just putting it all on like collecting from, at the high school drives, which what they do too in the US, they try to set them up regularly. As Gloria was mentioning, you had your first drive, which I applaud you on for with collecting your donors, but setting it up on a regular basis, like every 8 weeks or even every 16 weeks. So you introduce the concept of becoming a returning donor, and it's safe for the blood supply anyway. So
yeah, I think we hope that during this discussion, other innovation can be shared with globally through this webinar. Marcela, the next question is directed to you. By using, blood products appropriately, there is a decrease in the possibility of harm to patient and also save money. Like you say, don't collect what you will not use, or don't stock what you will not use at the wrong place. As you say in your in the answer of your first question. Would you say more about these conversions of improving care and reducing costs?
Yes, I think that essential to this is, as Daniel has pointed out, and everybody has pointed out in this webinar, essential to this is education of both blood users and blood recipients of blood also need to be aware. They need to ask. For example, we encourage patients to ask, do I need this? Do I need this unit of blood, etc.? And essential is also the participation of real hospital transfusion committees. Now it's mandated in the UK for clinical governance and for auditing of hospitals that they must have a hospital transfusion committee. That raises awareness in a big way, because before, our hospital transfusion committees were the blood bank director, the medical laboratory scientific officer working in the blood bank, and perhaps 1 or 2 nurses. Now, all specialties that use blood need to have a representative in the hospital transfusion committees. You need, and there you need to explore as well the hazards of transfusion that occurred during the previous month. Those are collected, and we have every large hospital has a specialist in transfusion. We call them the SPOTS, specialist of transfusion medicine. And this usually are nurses or medical or biomedical scientists whose only duty is to educate staff in the hospital on the appropriate use or not use of blood. So every new doctor who comes or every new nurse who comes to the hospital gets an education, a formal education on the need or lack of need on appropriate use of blood. And because this is part of the auditing of hospitals and of the clinical governance, everybody participates. And in this way, as I said before, we have managed to reduce significantly the use of blood without anybody saving, without anybody being short of blood. So I would recommend that. And again, I insist, the political will is extremely important. Also, being a national service, for example, we realized that, well, I never believed in convalescent plasma. I wrote a paper for Latin America saying that convalescent plasma wouldn't work for the severely ill patients. But because we're national, we did a study was done following up the patients, and it was realized that convalescent plasma did not help the severely acute COVID patients. So we have stopped collecting and transfusing convalescent plasma. We had loads of it in stock, and we're not using it any longer.
I agree with you.
Good, thank you.
Explain more for what happened in the region where you work, Laurie. You agree? What is your
agree. So I'll tell you, I think it's because there was so much fear and people were so sick and there were so many people hospitalized that there was this desire to do something to help. So they started back, they had used convalescent plasma historically for, like, I believe Ebola and another pandemic years ago. So they started collecting it, but they really didn't find that there was much support, like the scientific, they believe, you know, when they get down to looking at the actual neutralizing antibody and, you know, the titer of the antibody. But I think they did it in the beginning until it really came out that it wasn't making a difference, that they stopped. They still get a little bit. I was asking some friends who work in a transfusion service that they still have a few units in their freezer, but yeah, so that was one thing. When you say what didn't work, I wouldn't say didn't work. They tried and it wasn't, you know, it wasn't really evidence-based so much. And then once, I think early on in the illness, if they use it, they speculate that it'd be better, but yeah. Thank you, Marcela. I think that was very interesting what you said.
Absolutely. So thank you, Marcela, and thank you, Laurie, for being for answering this question that many people are want to a problem many people want to understand in the world. Daniel, I have a question here for you. What key factors must be taken into account when transforming and restoring African countries' blood supply?
Well, thank you very much. I think as Professor Marcela stressed earlier, I think the education is the most important thing. Like, of course, not only education, like involving all stakeholders in the process. Like the donors' knowledge is very important, because if the blood donors knows the importance of giving blood to someone to save life, then they can willingly just give blood, because humans are all, we are social animals, so we believe on supporting each other. So educating the blood donors is very important. If you educate our community and people around us, and giving blood doesn't really cause any health problems. Giving 1 unit or 2 units, and because the blood will be replaced in a very short period of time. So educating the blood donors is very important one, but that education cannot be done by just only specific group of people. It needs to be, planned and structured, where the blood transfusion service would be managed maybe by Ministry of Health and all those kind of things. So again, involving all the stakeholders like the nurses, doctors, physicians, if all understand the value of this blood and then work accordingly, keep the safety of the blood, then I think that would be, it will save blood, and also it will help us to get more blood from our donors. And the recipient also should know the value of the blood that is given by someone, that in order to save their life, so that, in their terms, again, they can also educate people in the future, including the families and all. So that is very important to stress, that education is very important. Apart from education, like I earlier said, like if we can work holistically, involve all the stakeholders. If you have, exclusively working together, then we can manage to collect more blood, and the collected blood could also safely reach to the recipients. Then we'll avoid all those wastage and all together. And the other very important thing is I usually stress on researches. Research is very important component of solving problems, because most of the sub-Saharan African country or low-income countries, they just copy some, guidelines and all those things and trying to implement it, but without, understanding it, or without, feeling it inside. So doing research, it will help us to identify our own problems and why we're not collecting more blood from, from the people, why people are not just voluntarily give blood, than just whenever their parent gets sick and just give blood on on the terms of replacement. So like I said, research is very important. If you do those researches, find out our problems, then we can find a solution to that, so that at the end of the day, the blood donation, collection will be improved, people will be mobilized, and then we can have sustainable blood supply like the Western countries. In addition to that, we can also learn a lot of things from the West, because at the end of the day, like we see it from the West, almost education is 100%. But when it comes to the low-income countries, there are lots of people that are not educated. Culture, belief, and all those things are still factors to collect blood. But as we go on educating our people, then the problem will be solved in a short term in that senses. Those are my points.
Thank you. Thank you, Daniel. So there is education, 2 types of education. Education of the nation, the people, the communities on the value of blood, the value to give the blood, the value to receive, the gratefulness to receive, we have to be in when receiving blood. And also joining what Marcela and Laurie was saying, educating people at the point of care for the quality of the blood to be respected, the right blood at the right manner, so that you bring economy and you are you provide more care with the same amount of blood collected. So this is important. So academy and scholarly education, but also community education. Gloria, many students do not know the importance of blood donation. What is the Surgery in Higher Interest Group at UJG doing to combat this?
Thank you very much. So starting with UGH, we started by first educating and telling students what is the importance of blood donation. And through the sensitizing the program, we really wanted to help the students at the school know what is the importance of blood donation and how it should be done. And also through this inner blood donation program, we want to go out to the community and also be able to tell others what is the importance. And since many young people in these times use a lot of social media, on our social media, we try to give out the information of what the importance of blood is. And we would like to do more of sensitization and education inside the school and also outside the school, so as to help many young people and students know more following this inner blood donation, as we are going to be carrying out more of blood donation and education.
Thank you, Gloria. That will be part of the problem and the education Dr. Daniel is talking about. Laurie, there is a question directed to you. What is one lesson learned regarding blood banking from the pandemic that you want people to get out from here with?
Well, one thing that really strikes me is how quickly people really did respond when you think about everything shutting down the way. I mean, it kind of slowly started, but once things happened, you know, I feel like at least in the United States, the blood centers, they had, whether you support, you know, the CCP, the COVID convalescent plasma, but they really, in the beginning, just the fact that they were able to kind of shift into manufacturing, and you probably all remember, there was such a problem with the supply chain and getting, you know, whether it's PPE or testing reagents or whatever, but the fact that at least here they were able to respond pretty quickly. And that was, to me, kind of just remarkable to watch the way the FDA shifted gears, because they've always really dragged their feet, you know, with changing things. But lesson learned, I'm just so grateful that we're kind of at least kind of coming, hopefully kind of moving through the whole pandemic, and hoping that we can get things back to normal. But you know, it's interesting with we are having serious problems with lack of blood donors too. So, you know, with all these things that we've done, we still don't have the numbers of people going out to donate. So they haven't had to suspend. They've begun doing elective surgeries and procedures again, but there's talk that they may have to suspend some of that. But anyway, and also, one thing I want to say, and this is Marcela, because I'm a total advocate of patient blood management, but you are so right, because I think one thing in the United States, I believe actually UK they were ahead of the US for this, for patient blood management, with having like your shot with, you know, reporting adverse event, transfusion events. But I feel like there has been such a push, and it's not like in the UK, you've got the one system. We have the FDA, but we have, we're really trying with our AABB, which is our kind of, really they're international, but the American Association of Blood Banks, that used to be the name, but it's really the acronym is the name now. But they've been trying to support patient blood management, but because people have, the utilization has decreased. And I think that helped prepare us for this shortage because people aren't using as much blood as, say, 10 years ago.
I'm going to ask the same question to you, Marcela. What was the one lesson learned regarding blood banking from the pandemic, in your point of view?
I believe that the most important, perhaps, answer was that we were prepared. You know, we were prepared. We've got, because we have a national system. I think that's the beauty of a national system, that we have an emergency plan for the country. For the national blood plan, there's an emergency plan for the country. So once you know that, and we had a pandemic plan, although we never thought we would use it. As soon as we knew that this was coming, there was more emphasis on patient blood management, and there was more emphasis on collection of public donor sessions, because, as Laurie said, we lost our universities. Our university collections were not there any longer, and those are, and our institutional collections were also not there any longer. So we shifted our blood program towards the collection in public sites where people could go. Of course, there was less collection, but there was less need as well. There was less blood connections because of the distancing that was needed, and our blood mobiles, instead of holding 6, would only hold 2. So we shifted towards collection in public places that were abandoned because of the work at home recommendations. So that's what we learned, that we couldn't have so many sessions planned in institutions and in colleges and in schools. Because I've got the right to speak now, I would like to tell Dr. Danielle that I think he's very right in that research is needed, African research is needed, and we should stop all this nonsense of research grants only for sexy things. Could I call them molecular genetics and genetic engineering? And we should have more epidemiological research, more things that matter for Africa. And I am an advocate for that. We need to know what the problems in Africa are. Why are people not coming to give blood? And what is the best approach to blood collection in Africa? I've had lots of discussions with my colleague and friend Jean-Pierre Alain, who thinks that replacement donors should continue for Africa, for example, for Ghana. I still do not believe that replacement donors should exist because there's a hidden paid blood donor there. But that's not the question I was asked, so I'll stop here, but that's very dear to my heart.
No, please contribute, because this is, we distribute question to have to tackle the maximum of subject, but we also want to tackle the maximum of ideas and avenue, because this is also interesting that you share your experience. It's very instructive. Please, question or not, answer, Marcela. Continue.
I think, Danielle, you should insist on getting grants for the research that matters for blood donation and blood collection and blood services in Africa. We should try to help you to write grant applications, and people, institutions like Bill Gates. Unfortunately, the WHO doesn't have money for research, but there should be avenues. And I am really ashamed that my country has cut the aid budget to the developing world. Yesterday, they've cut the budget by billions, by £2 billion. But we still should insist on having local research for local Africa and epidemiological research.
I let you, and I have to tell you that I agree with you, Marcela. And this is part of those sexy research are research that please to the Western countries. Huh? They are not research. Of course, they save life, but they are not the research that save the most life. And this will be part of the big movement to decolonize global health, because it's a colonial agenda to do the research that please the people who can pay, not research that are the most needed for people who are in the global south. Even if South and Western are a representation that we should stop talking about, but let's say rich countries and low and mid-income countries. If you want to do the research that matter to save lives, and implementation research that allow countries to implement what the world know according their own context. It's exactly what Dr. Daniel was saying. Dr. Daniel, tell us for the same question, what was a lesson you learned regarding blood banking during this pandemic?
Okay, that's very good questions. And as the pandemic strike, I mean, it created chaos around the globe, where everybody was not prepared to respond accordingly. And there were many surgeries that have been canceled, and people are afraid to go to donate blood, to go to the institution and everything. So a lot of people, we lost a lot of people because of shortage of blood. But at the same time, the blood, not only donation, the recipients are also reduced to the extent. The Western have managed the crisis to the extent in terms of, learning from the pandemic. But the only problem is during the early stage of the diseases. But now, when it comes to the third world or in Africa, we're not really learned a lot from those experiences, even from the high-income country in terms of managing the crisis altogether. But there are specific countries who perform very aggressively to those pandemic, like Rwanda is a very good example to that. And also there are other countries.
There are other countries. We lost you. You will come back. Gloria, what could you tell us about this same question, about what is the lesson learned regarding blood banking from the pandemic? Because I know that you have exchanged a lot among students around this program.
So thank you very much. I think as COVID hit, like many people are not allowed to gather and meet and be able to donate blood as they usually did. So that really has been a problem to blood donation in different countries and also in Rwanda. But what's really important that I learned from COVID and through blood donation and in Rwanda is that having a system that is organized is a very good thing. So, and also securing a sufficient number of regular donors is also a very good thing, because it helped Rwanda, like in the COVID-19 situation, to be able to contact their regular donors to donate, since they could not gather and mobilize anyone in different ways they usually did. It was easier for them to contact their usual regular donors since they had them, and since they had a system that knew how to track that and be able to track their regular donors. So from the COVID-19 situation, I think I really learned that having an organized system and securing enough number of regular donors is really important. And also, the RBC did, thinking outside the box and knowing how and when to contact their regular donors, since they have secured a certain number of regular donors, was a really important thing, because you never know where pandemics and things which are unexpected happen.
Thank you, Gloria. So, Marcela, you spoke about the importance of countries to have plan in place for sufficient blood supply. What is in place in the framework of centralized blood services, ensuring that it reaches the most vulnerable?
I think the most important is, with regards to red cells and plasma and cryo, it's to have, because we have national stocks, we increased our stocks because we knew that we might, whenever there is a catastrophe or a pandemic, you're going to not have enough donors. So we we usually have 5 reserve. So we have all the blood banks very well stocked, and on top of that, we have 5 days in addition to the stocks needed. When the pandemic comes, we have we increase our stocks, our reserve, to 15 days. So, and because and we explain to blood banks that they need to control the blood transfusion medicine units in hospitals, that they need to control better the blood stocks, even if they are controlling them well. And and for platelets, we are in continuous communication for platelets from apheresis donors, that it will be safe for them to come to. We have donor clinics throughout the country, apheresis clinics throughout the country. So to encourage them to continue coming. And that's in that way, we didn't have a shortage we haven't had a shortage during the pandemic, that it's still underway here in this country. But fortunately, hospitalizations have decreased, and the ITU, intensive care units, hospitalizations have decreased as well. So we're going back to routine surgery, elective surgery, and that's what we did. So increase our stocks. And that's why it's so important to have a national service. I will continue insisting that we have to make countries aware, governments aware, ministers of health aware of the importance of having a nationally coordinated blood service, and for them to spend some money in resources for a national plan for blood.
May I ask a quick question? I was just wondering.
Absolutely. Go ahead, Laurie.
Just very quick, with increasing it to 15-day supply of blood, did you have problems with blood expiring, or do you freeze it all, or how do you handle all that blood?
No, a bit, but we always say we always encourage hospitals to use their oldest units. So yeah, a little bit, perhaps a little bit increased wastage, because we monitor wastage as well. But it wasn't because they were using the oldest units first, even if they don't like it. But because there is a lot of this education that's national. The wastage wasn't really, it increased a little bit, but we have a very small wastage nationally. So no, we didn't increase wastage very much.
And for you, Gloria, can you expand on how UJG and Butaro community will benefit from blood donation program? What you say to the community to mobilize them?
So I think through the blood donation, we're able to save lives in our country. And also, you never know, I think, while mobilizing the community is telling them that sometimes you never know you are the one in that situation and you're in need of blood. So I think we should start helping each other and knowing that blood saves lives. While reading, I saw that you can donate and save 3 lives by donating blood. So I think that's a very important thing that we can do and still do it continuously. Since blood in Rwanda is given freely. So I think we can contribute to that good that our country is doing and be able to save lives in our country. Also let other countries learn from us, because I think we really have a good system that is also improving.
Thank you, Gloria. There is, I know that we are almost, I should not ask that question, but there is Jean-Baptiste Niribizi that asks to panelists, in order to minimize the waste of blood to be collected, and also considering blood donors' life, blood spheresis is key. How do panelists see this improving now and in the future? Who want to take this question?
I mean, we collect a lot of products through apheresis here, but it's something that requires equipment, and it's kind of expensive to purchase if you're, you know, the automation for collecting it. Ideally, it would be great if they could collect like do apheresis and collect red cells specifically, or platelets or plasma. That's why I don't think, I don't see it happening in Africa right now, but maybe, what do you think, Marcela?
I don't, no, that wouldn't be my priority. Apheresis wouldn't be my priority. But I would, again, I go back to the national plan, because you diminish wastage, because you can move your blood to wherever it's needed, so you never waste any. And we confirmed it in Chile, we confirmed it a little bit in Peru as well, that where the situation, where these are not rich countries, and they diminish wastage by sharing blood supplies.
Thank you. So I think we have answered all the questions that are in the chat and has been sent in other ways. Also yours, Alain Steron, about what are the most critical conditions that require blood transfusion worldwide. I think Marcela, Daniel, and Laurie have answered your request, as much as how to do mobilization of the population. And I think it's we have even reached the end of this session. So I want to thank all our speakers and also the audience for attending this fascinating conversation and so needed conversation, and for using this platform to contribute to raising global awareness on a so important subject, safe and sufficient blood supply. We have learned a lot from your insight, dear speakers, and the contribution you have made. We must also all understand that to follow the guidance you have given on how to create, to maintain, to improve, to transform the national system, and having a plan in case of disaster management is very important. The world needs to reinforce effort on voluntary donation and use campaign to raise awareness, encourage the young people and the adults to take part in the movement, and create training opportunities to ensure safety for blood donation across the world. And through education and through community awareness. I thank again our wonderful speakers. We have now actionable measure and solution to be taken to mitigate blood donation hesitancy and increase self-sufficiency of blood products in countries, but especially in low and mid-income countries. It's an equity agenda. It's part of the universal health coverage. And us at UJG, because we have equity in our name, we found that it's critical to bring together experts like you, change makers like you, champions like you, to help saving life in this, especially in this challenging time. Thank you, Gloria, for representing entire surgery interest group. And thank to all the MBBS MGHG students at UJG for hosting us today. And if you want to be in touch with entire surgery interest group, please find them on Instagram and Twitter at @IntareSig. For those who wanted information on the condition to be enrolled in the blood banking system, there was a question about that said by John Kavingi from Mbarara in Uganda. For those who want information of the course that is going to be launched with Rush and UJG, don't hesitate to go to the website of UJG or to contact Dr. Daniel, that is leading the program at UJG. The webinar recording will be disseminated on UJG channel shortly. This is also one question sent by John Kavingi. All the questions that has not been answered, if they are sending quickly, all our speakers are committed to answer them with the hashtag Professor Agnes on Twitter, Instagram, and Facebook. But when we say goodbye, we will not take more questions. Because this session is closed. It was a great session. Thank you, Marcela. Thank you, Gloria. Thank you, Laurie. Thank you, Danielle. Thank you to the communication team who have organized this and help us to exchange across continents and across institutions. And thank you for the people in the office who have communicated with all of us to make sure we were saying the right thing at the right time during this webinar. So looking forward to seeing you next month to the next Ask Professor Agnes Equity webinar. Bye-bye, everybody.